Hi, my name is Dr. Dirk van der Spy and I'm an orthopedic hand surgeon practicing in the southern suburbs of Cape Town. Welcome to Cape Hand Surgery. Base of thumb arthritis is the most common form of osteoarthritis that we see in the body. In fact, this is the first joint in the body that typically gets involved, as the thumb is the only joint that can circumduct or move around, opposed to any other joint in the body. But this comes at a price, and therefore this joint commonly gets arthritic. Because the thumb really involves 60 to 80% of all the hand function, once this joint gets arthritic at the base of the thumb, patients typically get pain in all hand movements, especially pinching or power grip or any other grip strength that they use in the hand. So the base of the thumb joint is essentially the CMC joint. The CMC joint is the carpometacarpal joint, and this is the STT joint. In between sits what's called the trapezium bone, and the arthritis really evolves around this joint. What you can clearly see here is that there's the ligament between the first and the second metacarpal is failing, and therefore it looks like the metacarpal is falling off the cliff. And as a result, we think this is what's causing the arthritis. On this x-ray, you can clearly see all the signs of osteoarthritis. There's large osteophytes, there is bone on bone, and there's no cartilage in between the bones. This is a normal cartilage interval, and this very specifically shows that there's absolutely no cartilage left in this joint. All the loose little pieces of bone around is also typically seen in osteoarthritis. The conservative treatment for this condition essentially is some splints and anti-inflammatories. But when it gets to complete loss of cartilage, there are very little else that we can do. And once activities of daily living is affected, like basically dressing, opening bottles, turning keys, or just basic handwriting, this operation should be considered. What we've been doing for this specific procedure is trying to take away the painful articulation, which is the trapezium and the metacarpal. So what we've been doing over the last 150 years, the common step of this operation is to go and take the trapezium out. It's called a trapeziectomy. But in the same token, we need to go and reconstruct the ligament between these two, and various techniques have been used over the years. Recently, we've been starting to use an implant called the tightrope that changed the use of a normal one of your own tendons, and we've had excellent results with this procedure. And essentially what we do, here you can clearly see the trapezium is taken out and there's a void created, and the tightrope is now aimed to do a reconstruction. The tightrope is inserted in the normal vector of the beak ligament, trying to reconstruct the original anatomy. The tightrope is then pulled through from the first to the second metacarpal, and here you can clearly see a very strong suture that we use with two endo buttons. At the end, you can clearly see now the articulation, the trapezium is out, and there's no bone-on-bone contact, and that's why people have so great relief in pain. In the same token, the beak ligament is reconstructed, and patients can start to move immediately. Post-operatively, we typically put them in a small thumb spiker that they wear for 10 days, and then they are splinted for another 3 to 4 weeks. We're trying to get the thumb motion back as quick as possible and strengthen the hand. If you are suffering from severe base of thumb pain, especially swelling at the base of the thumb, it is worth having it checked out, because maybe you can have base of thumb arthritis. The procedure for this intervention is a really winning procedure, and you'll have great relief from your pain. Thanks for watching, and please feel free to visit the website at www.capehandsurgery.co.za or follow us on Instagram or Facebook.